Now we'll get into TVCCA Connect specifically. So how we started was we began with attending healthcare collaboratives to truly get to know our community medical partners. So we work with Yale New Haven Health Systems, so the visiting nurses of Southeastern Connecticut, Lawrence Memorial Hospital, and the Northeast Medical Group. So these partners provide referrals to us. And we were already pretty well known in the community. So TVCCA Connect was incorporated in 1965. So we're pretty established in the community. So when we walked into these collaboratives and said, I'm from TVCCA, people are generally familiar. So we already started with a pretty strong foundation. And we sent myself and our case management, our client service navigator, to community health worker training to become licensed community health workers through the Department of Health. So we established these direct partnerships, a direct referral system, and that education piece to truly understand community health too. So we utilized Connecticut's community health needs assessment in determining our highest contributors to readmission and Medicare spending. The community health needs assessment indicated that COPD, CHF, and diabetes were the highest contributors. So we truly targeted those three illnesses in our client population. And then 150% of the federal poverty line was our income threshold for the program. And originally in the grant, we targeted ages 60 and over, but we found that there was this kind of unique population between, I would say, 45 and 59 that were homebound and chronically ill, but didn't qualify for too many programs really. And the waiting lists through state programs were a little bit lengthy sometimes, but they didn't quite qualify for Meals on Wheels or senior resources. So they were in this pocket there where we kind of had to come up with creative solutions. So we're kind of taking puzzle pieces and putting them together to get them through until they were approved for those state services, which is kind of my favorite part of this program, coming up with those creative solutions to help fill those gaps. So we did take out that 60 plus age limit. So we were able to appropriately report on the clients that we were able to help through this. So for implementation, we created a direct cell phone line that providers can call to make referrals, collaborate, or seek guidance on a case. So the hospitals are pretty busy, the visiting nurses are pretty busy. So if they have to call and they get stuck in this menu or they get stuck on a voicemail, they're probably not going to continue calling. Right, so who wants to go through press 1, press 2? So we created a direct cell phone line where providers can call and they have direct access to myself and our client service navigator if they have questions or they want to make a referral or they're not quite sure if it's an appropriate referral maybe. So that helped break down a barrier and build a relationship with our partners because they know they're going to call, they're going to have access to us for a question or just to make that referral. And it helped because once we were out doing our home visits in the community, they still had access to us, right? So if I am out in the community and they call my desk phone, probably not going to get it till the end of the day. And then you're looking at a couple hours at that point. So I think the cell phone was really helped to build those relationships and that trust within the medical community because they didn't have to wait to get answers in their busy schedule too. Because if somebody comes into the ED, by the time I'm able to return that call, maybe they've already discharged. So it truly helped to build those relationships and have access to those referrals and clients as quickly as possible because that quick intervention is important. So we were also able to gain read-only access to Epic medical records, further breaking down those barriers in care coordination. So we added one more referral source so they can refer through fax or medical record or calling, which is a huge help too in just care coordination because clients who discharge from the ED have a really keen ability to misplace their discharge directions. Or they receive a lot of information from the hospital and they're kind of just trying to get out. So they say, we scheduled this appointment, and this appointment on these dates, on your way. Having access to Epic has really allowed us to follow up. So we can say, hey, do you know you have an appointment in a week to follow up? Oh, I forgot. Okay, let's schedule transportation to get you there. So having access to Epic has helped us a lot with that, but it's also a lot easier for the ED to refer quickly, to refer patients quite quickly. And then, of course, our original by fax, they can also send it by fax. TVCCA also has general case management. So anybody in the community can walk in and access case management services that are goal-oriented. So TVCCA Connect differs from our general case management services because we place a specific emphasis on sustainability related to their complex medical needs. So we're still goal-oriented, just like the case management services, but a lot of our clients are chronically ill, and that's not going to change for them. Whereas in case management, if you have this immediate housing need, we help you with that immediate housing need, and now your housing is stabilized. So you're in a better position. Whereas if you have COPD, your COPD is not going to change. Your crisis related to your COPD are not going to change. So TVCCA Connect really focuses on how can we address your medical needs so in the future you can continue to maintain this sustainability, maintain your COPD, maintain your diabetes, maintain your CHF appropriately, right? So how can you access your medications going forward? How can you, let's budget so you can afford your medications going forward. Maybe this medication isn't working for you. Let's talk to your doctor about finding another medication. So you have diabetes. Let's figure out appropriate foods to help you maintain an A1C that is appropriate based on your doctor's recommendations. So we focus a lot more on that long-term sustainability because your situation isn't necessarily going to change. So how can we keep you home? How can we reduce those healthcare costs so you don't, in the middle of summer, 90 degrees, go back to the hospital because you don't have access to an AC to help your COPD. So you're not exasperating your COPD each summer, each hot day. So we do also purchase ACs and help to install them so that people can stabilize their COPD. So we really focus a lot on, we know you're going to likely encounter a crisis, again, related to your chronic health condition. How can we better address it, or how can we lessen the amount of times that you're utilizing the healthcare system in serious emergencies? Maybe now you recognize the signs, so you can call your doctor sooner instead of waiting till it's an emergency situation. But again, anybody can access our case management services, and we work off of a 3-month model, and we do home visits too, which helps break down a barrier to receiving services. A lot of our clients are homebound based on their illnesses. So we do those home visits. We're able to get them services from their home. You also learn a lot about somebody when you're in their home. They're comfortable in their environment. They're willing to speak a little bit more freely. So it's, the home visits have truly been a great success in the TVCCA Connect program. So what worked for the TVCCA Connect program? Encouraging sustainability, I would say, worked the best in these situations. So each year we know that you're going to need energy assistance to help offset your energy costs. So in the summer, you can make sure you have access to AC, or maybe you need medical protection. Let's get you medical protection so you don't raise your heating bill so much that you can't afford it. So encouraging that long-term sustainability has truly helped our clients long-term. Building strong relationships with the community, with nonprofits within New London County, and with local small businesses. So I probably spent the first, I would say, 1.5 years only using New London County nonprofits or partners in New London County. But I pretty quickly realized that local small businesses are a huge asset to the TVCCA Connect program. So we have someone who had squirrels in their attic, which doesn't necessarily seem like a TVCCA Connect concern, but it was truly affecting their health, right? So we worked with a local exterminator and a local contractor, and we were able to lower the cost and partner with the client to get those squirrels out, but also a local contractor to get that hole boarded up in the house that the squirrels were coming in. So I really relied heavily these last couple of years on also small businesses and they're so willing to help the community. They've been a great asset. Direct provider access, like I mentioned, that cell phone line, and removing that 60+ age restriction in home visits and remote services. So with COVID, we've been providing a lot more remote services too. So we're not quite able to do home visits. Just with the chronically ill, having COPD is a huge risk for COVID. So we want to make sure we're having minimal exposure for our clients, minimal risk for contracting COVID, no matter how careful we are. So what were our challenges? So TVCCA Connect is a pilot. Originally, we partnered with providers that were going to help with recidivism data and cost analysis data. The pandemic severely limited our access to this information. So all of these partners just refocused our efforts to COVID-19 and just as more essential services at the time. So we don't have access to that data anymore, although it was in our grant as something that we would be able to provide. So we weren't able to evaluate cost-saving data and measure the programmatic impact on recidivism, just because we didn't have those partners in that data anymore. And we also found limitations in strictly serving individuals with COPD, CHF, and diabetes. TVCCA Connect has a no wrong door model. So we helped every referral that we received, whether it was through our case management services, and Connect referrals received TVCCA Connect services. But we received a lot of referrals for people who didn't have COVID-19, COPD, CHF, and diabetes. So we weren't able to track those clients, but they still received services through other TVCCA avenues. But we found that was a severe limitation in truly reporting out on the people that needed the service. So are we truly accurately representing the need in the community? So what's next for the TVCCA Connect program? So our grant ends in September of 2022. So we're looking at opportunities to really expand our health equity efforts across New London County. Like I said, we were severely limited in reporting on people who truly needed the services in all of the referrals that we received, because we did put in that COPD, CHF, and diabetes criteria. So TVCCA does have licensed community health workers across all of our departments. So we're looking at opportunities to integrate this into TVCCA Connect services, sort of just across the agency, and truly utilizing those community health workers. So we're looking at more opportunities to promote health equity, and still continuing to work with the hospitals, because there is a need in the community, of course. So we're looking at the best way to truly promote these services across the agency.